Evening. How are you?
So I think it's good to go. And
Yeah.
so I think we welcome everyone on behalf of Telemedicine Society of India, Uttarakhand State Chapter, in a series of webinars, educative webinars, and sessions on awareness to public and healthcare workers. Today we will have this webinar on disease organ donation. And not only organ donation, we will have an insight of telemedicine into this aspect also. We have very eminent speakers today, and we have Dr. Shroff, we have Dr. Pallavi, we have Dr. Vikas. I think without wasting any time, I would first, it's a pleasure to invite our President TSI UK State Chapter and Executive Director and CEO, AIMS Rishikesh, Professor Minu Singh ma'am, to start the program with presidential address. Please, ma'am.
Thank you very much, Ankur. Dr. Shroff, Dr. Pallavi, Dr. All other people who are there with us today, Dr. Vikas Panwar. And uh, we have been trying in AIMS Rishikesh and all over the northern India to promote deceased organ donation. And of course, it's a very difficult task. And that is what is becoming a hurdle in progressing in organ transplantation, in at least in this part of the country. How we can increase the reach of these messages to various entities is, of course, using technology, and telemedicine or teletechnology is one of them. And I do remember the program which Dr. Shroff had with Amitabh Bachchan in the Kaun Banega Crorepati, which was one attempt, I think, to highlight how organ donation can be done and how it can be encouraged and how that can lead to saving so many lives. So I think without much ado, I would request Dr. Ankur to proceed with this particular webinar so that we can all get enlightened. Thank you. Thank you very much.
Thank you so much, ma'am. And now I would request Dr. Uma Shankar. He's our Secretary, Honorary Secretary, TSI National Body, to say a few words.
Thank you, Dr. Ankur. And it's really wonderful that you keep doing every month one or the other programs. Now, as Meenu Madam said, that this is a very important topic. And
Dr. Uma,
from
I missed you. Welcome to the webinar.
Oh, thank you, ma'am.
Yeah.
Thank you. Yeah. So as we all know, that, and you will all be getting some information from the eminent speakers that the organ donation is a very critical issue in India. As we know that there is a significant gap between the demand of the organs and their availability. So I'm not going to go into the details of the numbers, but as far as my knowledge goes, I think kidney failure is the most common condition which requires organ transplant. And most of the lives, there are people there are waiting around there for their organs transplant. And if they get timely organs, we can prevent their deaths. And most often, from the public health point of view, when I see, we have a lot of challenges in India, especially there's a lot of myths and misconceptions regarding the organ donations. Uh, some of them, which a little bit of experience in organ donation, what I have is people have told that they are against organ donation because their religion doesn't permit. So these are some of the myths. I think all these can be addressed only with education and such uh, webinars or in the community or the tele health could really help improve this organ donation scenario in India. With that, I would like to thank the organizers for me to address the gathering. Thank you. And I'm sure the current speakers will give more light into organ donation. Thank you.
Thank you, Dr. Uma Shankar. I think with this, we move ahead. And I think it's a privilege now to invite our first speaker. And I will just, Dr. Shroff, I just need to, uh, you know, he is a man who doesn't require any introduction if we talk about transplant and awareness session and activities regarding transplant in India and abroad. But still, so what I want to say, he's a senior consultant and urology renal transplant in Madras Medical Mission Hospital, Chennai, and he was previous professor and head of our department in Sri Ramchandra Medical College. He's past president, Indian Society of Organ Transplantation. He's vice president, current vice president of Telemedicine Society of India, and he's the editor of Indian Transplant Newsletter. As Professor Meenu Singh ma'am said, that we remember when he featured as Karamveer on Kaun Banega Crorepati. I think moreover, it was not a show. I think it was an initiative for this awareness on a national platform, on such a big platform. And if I'm not wrong, I think it is the first time when any national platform went green. So the complete stage of Kaun Banega Crorepati went green in view of transplant and awareness. I think with this publication, I'm not talking about, he's a man beyond that. So I think with this intro, I will just invite him for his talk. Earlier, we were planning to have a talk on organ donation in India, but that part will be covered by Pallavi and Vikas. And Dr. Shroff really put his insight that how we can talk about transformational power of technology from an enabler to predictor. So I think, Dr. Shroff, the stage is yours. Thank you so much.
Thank you, Ankur, for this introduction. And thank you, Dr. Meenu Singh, our past president of Telemedicine Society of India, Uma Shankar, my great secretary, very dynamic, along with, of course, Pallavi, who is our backbone, and Dr. Panwar and others, so many in the room. Wonderful to see you. So what I'm going to do is share some slides. First of all, before I even start, I want to also congratulate AIIMS Rishikesh for having started not only living kidney transplant, but also disease donation transplant. And Dr. Meenu Singh said that there is a lot of challenges. Most of the challenges are in the hospital domain, according to me, not so much in public domain. Because the Prime Minister of the country himself has endorsed organ donation at least 4 times in his Mann Ki Baat. And that is remarkable. And that has resulted in, not only the public, but also the administrators looking at this cause in a different light now. But previously, when we used to talk to the administrators about organ donation or bureaucrats, they wouldn't give us so much of attention. But today, when we talk about it, they look up and they want more information. So this is the right time for us to get our systems right. And with the endorsement of the highest authority in the country, we are in a better position. So don't get disheartened. Uttarakhand will do very well. Believe me, Pallavi is sitting here with me. We have done 5 disease donation in Imphal, Manipur. So, if Imphal can do it, Rishikesh can even do better. So just go forward, believe in the program, believe in what you're doing, and we'll make it happen. So with this, I'll just share my slides because I know that I have 15 minutes and I'll try and finish it within that time. Let me see, yeah. Sorry. Share screen. Can you see my full screen?
Yes, sir, please.
So I'll skip this slide. And no financial disclosures or disclaimers. Let's start with looking at total kidney transplants worldwide. We do about 10 per million disease donation in the world. And, this includes both disease and living. And these are figures from 2000 to 2023 from the Global Observatory. So currently we do close to 100,000, transplants in the world. This means only 10% of the global requirements for organs, including kidneys. The requirement for kidneys is even higher in places like India. This is our figures from India in 2023, that's last year. And we did close to about 12,500 kidney transplants, of which majority were from living donation. We did liver about 4,000, hearts, lungs, pancreas, and small bowel. We did a total of 17,000 transplants last year. If you look at total kidney living donor transplantation worldwide, we do close to about 40,000 kidney transplants worldwide. 25% of all global living kidney transplants are done in India. So India is a highly dependent living donor kidney transplant country. If you look at the disease donor numbers from India from 2013 to 2023, you can see this graph rising from 2013, dipping in COVID, and again rising again in last 2, 3 years. So hopefully we'll get more organs as we go forward, and we got about close to about 3,000 organs from disease donors. We only do 3% of the global disease donor kidney transplants, whereas we do 25% of the living donor kidney transplants. So this is about the status of what the transplant program is at the moment in the worldwide and in India. So how can we use technology? Since we are part of Telemedicine Society of India, I want to show you how we can use technology to transform the whole organ donation ecosystem and how it has been an enabler in the last 20 years. And today with AI, we are also looking at it as a predictor. This gentleman Lenin said, in his this one, that there are decades when nothing happens, and there are weeks when decades happen. And this has happened with COVID-19 pandemic. And during the pandemic, digital health became the norm. And I think without, digital health, without telehealth and telemedicine, we couldn't have overcome the pandemic. With all the contact tracing which we did, all the vaccination which we did, was all possible and all the teleconsultations which happened was possible due to the telehealth platforms being available. And so this lockdown accelerated the adoption of digital technology, home care, self-care, teleconsultation, contact tracing, and vaccination, all that became a reality. The government of India was not behind. It actually brought out telemedicine practice guidelines. Just during, in March, it got it gazetted in May 2020. So today, telemedicine practice guidelines are a legal framework available in the country for practice of telemedicine. India has really transformed, I believe me, in the last 3-4 years. I see this. This is a guy who's selling these coconuts on the card, and you see that he's got a GPay there. And everybody is using, so India is truly booming as far as technology is concerned, right from the common man to anybody else. Everybody is using technology today. And that's been a really transformational. So technology should be used as a game changer also in organ donation in India. As a foundation, what do we do? Just briefly, we create awareness in the, among the public. We do education of the healthcare professionals. We do counseling in the hospital. We do a lot of research work. We work with the government on policies, and we use technology very extensively to promote organ donation and transplantation. We've been using technology from 2003, almost more than 20 years. We created first organ sharing registries as foundation to create transparency in the program. We use technology for social media to create awareness. We have got many apps which we developed for helping with donations. We have online training program for capacity building that we started in 2017. And we also do fundraising for less affordable. And these are all case histories of how technology has been very transformational in our organ donation space. These are organ sharing registries. This is the Tamil Nadu registry. We provided the software to Tamil Nadu way back in 2000. We started this software in 2000, as I said, 3. And then the Tamil Nadu government team took this software from us in 2008 for organ sharing for between 28 hospitals. And then that went up to almost 100 hospitals. And we also had an app for, kind of organ sharing. This is the Kerala government which took the registry from us, the software registry. We were running the registry for many years. And this is the Rajasthan government. We use technology for awareness, social media platforms, many kind of, especially during, the festive season. Now Navratri is happening, and we'll be doing that, in Navratri as well, using technology for creating awareness. And this is what you guys were talking about. So let me quickly run this clip of Karan Brega Crorepati for you. So just I'll just run it fast so that I don't take a.
डॉक्टर साहब अंतिम मैंने देखा कि आपने हरे रंग का रिबन पहना हुआ है, इसके पीछे कोई कहानी है? हरा रंग जो है वह अंगलांग रंग है, क्योंकि हम शरीर का रिसाइकिल कर सकते हैं, तो सर ये हरा रिबन लगे लगाना।
And this is when the set of KBC turned green.
तो अपने जमीन समझे को बताना चाहते हैं कि
So this was this when we did this program, we almost got, I think, close to 20,000 calls in the 5-6 days. And it really created a big ripple effect in creating awareness on organ donation. And it really helped the program to go forward. We also got some, not only, pledges for organs, donation, but we also got some donations happening after this program. We run an organ donation ambassadors program. This is a voluntary program, and we started in COVID. And this program is done online, and we have created ambassadors, through this program. We have close to more than 400 ambassadors, and they do a lot of awareness on organ donations throughout the country. They not only do awareness, but they also do a lot of, fundraising for us, and they've raised close to $8,000 for us. They do rallies, marathons, design stickers, write poems. Amazing force they are. And these are some of the ambassadors who really walk the talk. And if you look at this gentleman here, he walked the Narmada, 1,800 kilometers he walked. This guy took the whole, did a car rally, he took it through, from all over India, and then he went to England as well. And this lady created a lot of awareness on social media. So they did a lot of work on organ donation. We also use technology to, help with access to for less affordable patients. And how we use this is we use crowdfunding platform. In crowdfunding platform, what happens is you register on a platform for raising finances for a patient who is not affordable. And then we create campaigns on the social media platforms for, asking for funds. And those campaigns, once this, campaigns are done, then there's a little bit processing done on the order documents, and the campaigns is shared on social media, and then you start receiving donations. And these donations, when we receive for transplant, we do it for less affordable patients. We give it to the hospital, and we also negotiate with the hospital to get a good rate for the transplant, because most of the transplants happens in the private sector hospitals. And so we run a program called Anudan for this. And with this, we providing, as I said, financial assistance to economically underprivileged patients, especially children and women. So far, I think we've distributed now, this is slightly old slide, about 1 crore rupees. And we've helped with 27 liver transplants, 7 kidney transplants, 5 cornea transplants, and many pediatric patients, many women patients who have been helped. Because these are the patients, women and children don't get necessarily first priority, so we try and prioritize them. And Pallavi and Jaya are the people who are actually running the Anudan program for us quite successfully. If you look at various crowdfunding platforms called Keto and Milap, these are the slides I got from them. And in 7 years, if you see, they have raised substantial amount of money through crowdfunding to help with transplants, be it bone marrow, be it kidney, be it liver, lung. They have raised close to 682 crores, helping about 3,000 patients who are less affordable for transplant surgery. Quite a significant number. So, so using technologies in various ways is very useful in this program. So this helps with the access to patients who are not affordable to at least give them a transplant. Otherwise, usually it is said that the transplant is only for the rich. But by this way, we at least are able to help the poor as well. We have used technology also for training very effectively. Before COVID, we were doing many face-to-face training programs, but post-COVID, we started doing programs only online. And so far, we have trained almost 1,500 candidates from 16 countries. So the cost of our training program is very, very low. These are some of our online courses which we run. There is a 1-year course for transplant coordinators, a professional certificate course. There's a postgraduate course. There's family counseling course. There's legal course, brain death course. We also have courses for general public on how to take over your kidney, liver, heart, and so on.
Using technology for training.
We don't have time for this, show you this course modules,
in a pandemic
but very, very briefly.
Critical and transformative aspect of education. affordable cost.
So let me just skip this. We use this Moodle, an open source platform to build these courses. And these courses are very interactive, and I'll show you what these courses are all about. And you just give a glimpse. So this is, a text, and you see this text here. It is very nicely, kind of a lot of images are there. So this is one part of the module. We also have simulations. This is on grief counseling.
Is the shell because it is the ventilator machine that is pushing air in and out of her lungs. With all the tests, what we found is she's no more and not able to breathe on her own.
Is there any chance that Shakti can be brought back to life?
These are for counseling. We try and do a lot of simulation for counseling. These are professional actors we have employed. We actually film them. So we have these kind of counseling, videos, which the coordinators can see and understand and start practicing on how to, do counseling. And then we have this interactive, video, lectures. And these are, interactive lectures because, when you do a video lecture, the candidate has every 5 minutes, he stops and asks a question to understand how much the candidate has understood before it goes forward. So it can be multiple choice, it can be matched the, kind of images and so on. So we make it very interactive, this kind of courses. And we do ongoing assessment. They can't just, not do the assessment and go forward, because if they don't do the assessment, the course doesn't go forward. This is a green mat lecture of a faculty who is talking about disease donation, and she is talking about brain death. And, again, this is interactive. They have to answer those questions before they go forward. Very briefly, I'm just trying to show you what all, how we run these courses. And so these courses are very successful. And we use technology to the hilt to, make sure that these courses are very interactive and very, sorry, just let me just go back. This has got a little stuck, yeah. And these are supplementary courses which we run. These are short courses for general public. And these are 2 to 3 hours courses on how to take care of kidneys, liver, and so on. And these again are very interactive. In these courses, we use gamification also. This is like, is a puzzle which you kind of drag around and you show what a kidney is and so on. So we try and use gamification in these courses for general public on how to take care of your kidney, liver, and so on. See, this is another gamification. This is for the liver, where you have a crossword puzzle. And the feedback for these courses has been excellent. Almost 95% of the people have said the course is either excellent or very good or good. We have these apps. This is on Brain Death Certification app. Anybody can download it. How to certify brain death. This is for ICU professionals. This is for donor optimization. How to optimize the donor. Hand transplants. We are world leaders in hand transplants, by the way. We do the highest number of hand transplants in the world. So these have been all enablers. Now, we are using artificial, intelligence, AI predictive models to predict outcomes of transplants. So that's why I call this my talk as an enabler to predictor, So when you get a kidney, which is the best match, for the recipient, is decided by some arbitrary parameters like your blood group, cross match, and so on. And these predictions for long-term graft survival can only predict so much. The prediction, accuracy is only about 58%. And we have these algorithms for this, so this, if you use AI, you can make better predictions. The current prediction models are called, there is, KDPI index, this is Kidney Donor Profile Index, and Living Kidney Donor Profile Index are the prediction models which are available, which only take into consideration the donor parameters, but are no recipient or immunological parameters, because both the recipient and immunological parameters play a role in eventual graft outcome. So, and this relies heavily on statistical assumptions, these LK, the current parameters which we have. So we looked at AI to predict long-term graft transplant outcomes and donor morbidity. And we used the UK registry data and the UNOS data for this and developed 2 algorithms for both diseased donor and for living donors. The exclusions were below 18 years all patients who are about 18 years in our this one to be used, HLA incompatible donors and ABO incompatible transplants. And we divided the data sets, into training and testing data in the ratio of 80 to 20. The training data is set to the data on the actual training takes place, and then the test takes place on the data which is available. And we use these different, decision tree models called Random Forest and XGBoost. I don't have time to go into it, And we used 29 parameters, which included 10 donor parameters, 5 immunological parameters, and 15 recipient parameters to do the prediction model. So we've been working on this for the last 2.5 years. We've got 4 papers published before we have come out in open. We have a paper available on living donor kidney transplant outcome prediction by using AI. This is in the Nephrology, Dialysis and Transplant Journal. And we have another paper accepted in this artificial journal for artificial organs. And we have 5 collaborating partners for these predictive models: University Hospital of Coventry, NHS-BT, NHS UK. We have one hospital in US. We have a technology company in US called Extend AI. We have a technology company in India called MedIndia, and with Mohan Foundation. And we today, in fact, and this after we have a site now called organpredict.ai, where it's an open source site where you can test a patient's parameters before they go for transplant. And in fact, only today a press release was made by the NHS-BT people, and that was picked up by Times of India, and they just published today on the first page of Times of India. This news has come out on an AI-based system, identifies right recipient for kidney transplant with 80% accuracy. And these are the papers in NDT which was accepted. And this is a site called Organ Predict using AI. And this is a QR code you can use to go to the site and do your testing. I think I'm running out of time. I don't want to take too long. So in summary, tech is a great enabler and also now a great predictor. Is that technology can be very good as an enabling tool for access to health. Technology for organization can enable awareness of and affordability, enable access to online training. And of course, as I showed you, the AI algorithms are excellent as a decision making for allotting organs for kidney transplants. These are some of my references for my presentations. And this is my acknowledgement to my team, wonderful team of Mohan Foundation, which works very hard to create the right ecosystem for organ donation in India. So thank you very much.
Thank you, Dr. Shroff. I think it was a wonderful insight and a great information for all of us, and a great way to reach the information in a better way. What I want to say is today I am very happy that our audience right now, the house is full of our students, our nursing students, our undergraduates, our senior residents, our faculty members, our other healthcare workers, nursing workers. And I am very happy to see we have a liver team already joined with us. We have a neurosurgeon, Dr. Jitendra, is with us. So I think this per se involvement of everyone for this session itself, I think, is a good start, that there is definitely sensitization is there. The institute has already started the disease program, and we are very hopeful that things will go more fine. I think one thing which I want to just about the availability, because the students are hearing, is so these app what you were talking about, are there how to reach them, like how are they made available, and the informative modules, how they are made available to all?
So they're all free. In fact, you just have to, for the Organ Predict, you just have to, I showed you the QR code. It's called organpredict.ai. And we also have a lot of these learning programs for the nurses and the students and the faculty, in fact. And they're very popular today. They are more than, there are people taking it from not only India, from other countries, because of the cost. It's very low cost. And this is available on the e-learning, el.mohanfoundation.org. If I showed you all the courses, they're all available for you to register and take the courses. And we have kept the cost very low. There is small cost. The only reason we have kept the cost is because when you offer it free, many people start the course and don't finish it. So we have kept the cost very, very low, and so that everybody can take the course.
Okay. I think we'll have questions in the chat box and we'll have discussion after the talks.
I just wanted to make a comment that thank you, Dr. Shroff, for a very, very informative talk. And I think this technology and teams, those are two keywords which we would like to pick up from what you've said. And as you've shown that technology can be used in different ways to promote or diseased organ donation. It can be for education, it can be for setting up the system itself. And we have several apps and other things which you have already highlighted. And I think the websites that you have highlighted, they would be a very good resource for all this. And of course, building teams is another very important part. And we're very happy that so many of our team members are there in this webinar. And we have some 70 plus people whose very good number that they have connected. Like to congratulate Ankur for organizing such a such a good session. So let's go forward. Thank you very much.
Thank you, ma'am.
Hello.
Yes, ma'am. Thank you so much. Am I audible?
Yeah.
So I think with this, we can move ahead now. I would like to invite Pallavi. Pallavi is the Executive Director of Mohan Foundation. I would like to say that she has been instrumental in starting disease program in various states to initiate with Rajasthan, Manipur, and in those times when Manipur was burning. And definitely, and we have an MOU with Mohan Foundation, and she is instrumental, and Mohan Foundation is instrumental helping us in Uttarakhand also. And we have somehow started with our first, and we are seeing a lot more. Pallavi skills line working very closely with hospitals and government as well as private hospitals. And her key training areas include grief counseling and making the ask for organ donation, role of transplant coordinator, and helping start disease donation programs in hospitals. I think with this, I would request and invite Pallavi for her talk on basics of organ donation. Pallavi, please.
Thank you so much, Dr. Mittal. I would like to congratulate Dr. Meenu Singh and the entire team of AIIMS Rishikesh on your first donation. It is a spectacular event, but I think the real success lies when organ donation becomes a non-event in a hospital. When it is part of the process, it's happening, So that is what we have to work together. It's a great start, and I hope it makes many more donations happen and we can save many more lives in Uttarakhand. I will echo Dr. Shroff's sentiments that the problem is not so much in the public domain. The problem is more within the hospitals. We have to put our systems right. We have to train ourselves. We have to empower ourselves, and we have to be believing in this program. I always say it's a heart program. If your heart is not in it, it's not going to happen. So my short presentation, my focus is for our students here, for our nursing students here, for other doctors who have joined, for us to feel passionately about organ donation. I'll start by introducing you to a gentleman called Ram Ramawat.
नमस्कार, मैं राम रावत जयपुर से। मेरा हार्ट ट्रांसप्लांट हुआ 2018 मार्च में। डोनर के परिवार को कहने के लिए बहुत कुछ है, सिर्फ इतना मालूम पड़ा मेरे को कि सेलम से किसी भले मानुस का हार्ट आया था। ही वाज अबाउट 35 इयर्स एंड इट वाज ए एक्सीडेंटल केस। वो हार्ट मेरे को लगा था और यंग हार्ट लगा मेरे को, तो इसलिए मेरी इट वाज अ सक्सेसफुल ट्रांसप्लांट आल्सो। उनके जहाँ तक परिवार की बात है, मुझे नहीं मालूम है कि कौन है क्या है, लेकिन मैं आज भी पूरे परिवार का आभार व्यक्त करता हूँ कि उन लोगों ने इतना बड़ा काम, इतना नेक कार्य किया है कि आज जो मैं आपसे बातें कर पा रहा हूँ और जो जितना खुश मेरे को देख रहे हैं, जिस हालत में देख रहे हैं, only and only because of that family and that person जिन्होंने जिनका मेरे को हार्ट ट्रांसप्लांट के बाद में अब जीवन एकदम नॉर्मल है और मैं बिल्कुल सारे काम वापस जैसे पहले करता था सब करता आ रहा हूँ बाहर विदेश में जाता हूँ देश में भी जाता हूँ खूब ट्रैवलिंग कर रहा हूँ खूब आराम से अच्छा जीवन व्यतीत कर रहा हूँ आपको बता नहीं सकता हूँ मैं अपने परिवार के साथ में ये दूसरा जीवन ये दूसरी इनिंग्स पा करके जितना खुश हूँ मैं शायद पहले भी नहीं रहा हूँ जिनसे मेरे को हार्ट मिला है जिस परिवार से हार्ट मिला है मैं उनका दोबारा आभार व्यक्त करता हूँ मन से और मैं उनके लिए अगर कुछ भी कर सकूं जीवन में मैं बहुत अपने आप को लकी फील करूंगा
So the question is, why should we talk about organ donation? Why at all there should be a need to speak about organ donation? Why should our webinar today be dedicated to organ donation? So basically, we have some really scary statistics in front of us. And to be very honest, these statistics only represent the metros and the tier 1, tier 2 cities. What is happening in smaller cities and villages don't even make it to these statistics. So at best, they are very underrepresented statistics. So it is said that close to 5 lakh Indians require some kind of an organ transplant annually. Less than 10% are able to get timely help. And when we use the word timely help, it means for the others who didn't get that organ in time, they simply died. And at least 10 patients die every day while on waiting lists for organs. Again, these waiting lists are only maintained in those handful of states that have taken this program forward. Other people don't even have a waiting list. Other states don't even have a waiting list to show how many people require organs and how many are dying. And every 10 minutes, a new name is added to the waiting list. So for every organ that is lost, that is wasted, a life is lost. A life like Mr. Ram Ramawat that you met, loses his or her life. So coming to organ donation, one second. Organ donation is of two types. There is a living donor, there's a deceased donor. I'm sure most of you know it. For a living donor can give a kidney and a portion of his or her liver. According to the government of India, it has to be an immediate blood relative. So parents, children, siblings, grandparents, grandchildren, and they've also included spouse in this category. Other than that, it could be someone who's not related, but it has to be approved by a committee and it has to be established that there is no monetary transaction between the donor and the recipient and that the donor is giving out of his or her free will. There is no duress, there is no compulsion on the donor to give. He is giving because he or she wants to give to save someone's life. What we are interested in is what is called a deceased donor, not to be confused with a diseased donor, not a sick person, but a person who's no more, has died, has no use for his or her organs, and so beautiful that does not require those organs. You can save so many lives. And that is what we are really looking at, because other than liver and kidney, for every other organ, you require someone who has died. And even for liver and kidney, many families do not have donors who are willing to give, B, have healthy organs, healthy liver or kidney to give, and 3, are matching donors. So for various reasons, we have to rely on a deceased donor. There also is a lot of trafficking in the country, and we truly believe, our president said that there is a huge demand and gap supply. And we truly believe that if we improve the deceased organ donation rate in our country, even the trafficking will come down. A deceased organ donation can only happen in the case of brain death. Dr. Vikas will speak about it a little later after my presentation. But it is important to understand that a brain dead person is in a hospital, in an ICU, on a ventilator. We get many calls from families saying, so and so has died, and we would like to donate organs. The moment your heart stops beating, the organs stop getting oxygenated blood and they also die. So it is in this controlled situation where the person is in an ICU on a ventilator. And that is why the role of the hospitals becomes so crucial. Having said that, in natural death, you can donate what are called tissues. And the most commonly donated tissue is the corneas. And it is very sad that in 2024, more than 50 years of speaking about corneal donation, we are still facing corneal shortage in our country. And I speak to a lot of families and I get a lot of no's, and I understand that organ donation is a much bigger ask. But I feel in this time and in this century, eye donation should be happening more easily. And I know AIIMS Rishikesh has a very good eye donation experience. They get a lot of corneas. But for those of you who do not understand what eye donation is, only the corneas are removed. Cornea is a thin, transparent layer on top of the black portion of the eye. It's such a small organ, and the whole process is so simple. I know that because I donated my father's corneas, and the team came, took away his corneas, and left within 20 minutes. It was such a small process, but it is important for you to convey to people who want to donate corneas that the idea is that a cornea should not get dry. So when somebody dies in the house, close that person's eyes, keep some moist cotton on top of the closed eyelids, switch off the fans. If possible, put the AC on, but that's okay if there's no AC. Raise the head slightly, put a pillow or something, and call the nearest eye bank. Call the nearest hospital, call the nearest, you can call Mohan Foundation, wherever we are, we will coordinate it. And it has to ideally be done within 6 hours of death. In winters, we can, increase it to about 8 hours, but such a simple process, such a beautiful process. There is no disfiguration to the eye, there is no bleeding, and you're giving sight to people, and sometimes even more. Dr. Shroff talked about this. What does the Mohan Foundation do? We are here to create awareness, to do capacity building, to help you start programs, to help you with your desire to make donation happen. What can you do? A, become informed, learn about what brain death is, learn about what organ donation is, and then decide whether it's worth for you to become an organ donor. So you pledge to be an organ donor. You can pledge with Noto, you can pledge with anybody, doesn't matter. It's not a legal action. It's only an expression of your willingness to be a donor. Give your time. You can become an ambassador. Dr. Shroff talked about the ambassador course. It is meant for people who want to give back. So we have a short training program. You can undertake that training program and then yourself create awareness like we do across the country. So let me then introduce you as I wind up to another person. 1 second. Another family, so to speak.
मेरे फादर मिस्टर हेमंत कुमार अग्रवाल की 12 मार्च को डेथ हो गई। उनको ब्रेन हैमरेज हुआ था, जिस वजह से उनका ब्रेन डेड हो गया था। हम लोगों को हमारी बुआ ने हमें बताया कि हम ब्रेन डेड में उनके ऑर्गन्स डोनेट कर सकते हैं। फिर हम लोगों ने डिसाइड करा कि हम उनका ऑर्गन्स डोनेट करना चाहते हैं। हमने ये डिसीजन इसलिए लिया क्योंकि हमें लगा कि इस डिसीजन से पापा विल लिव फॉर एवर, और वो अलग अलग इंसान में जीते रहेंगे जैसे वो हमेशा जीते थे। He was a person full of life. He never stopped living his life, and we don't want him to stop living after he's dead. हेमंत एक बहुत जिंदा दिल इंसान थे और अपनी जिंदगी को उन्होंने शाही तरीके से जिया। बस इसी सोच के साथ मैंने उनके ऑर्गन डोनेट के लिए हाँ कर दी कि वो हमेशा अपने हमारे साथ तो शायद वो टाइम कम दे पाए और लोगों में वो जिंदा रहे, और इसी वजह से हमने उनकी फोटो पर आज तक माला नहीं चढ़ाई कि जब तक वो लोग जिंदा हैं तो हेमंत अग्रवाल भी जिंदा है।
पापा मतलब बहुत ही अच्छे इंसान थे, मतलब मेरे बिल्कुल एक बेस्ट फ्रेंड की तरह थे कि मतलब मेरे को कभी उन्होंने पढ़ाई के लिए प्रेशर नहीं डाला, मेरे सारे सपने पूरे किए। एंड बस अभी हम लोग और क्लोज आ ही रहे थे, फिर वो उनका जाने का टाइम आ गया।
So as I wind up, I just want you to meet a few families that I have had the privilege of counseling and helping them take the donation decision to donate organs, and look at what they have to say. This is the husband of Mrs. Namita Kapoor. She died pretty young. She was 56. And he says she died early, but she had a full life and lived completely. She gave so much in her death as well as she did while she was alive. So when I spoke to him, he said, हमने कभी organ donation की बात नहीं करी, but वो इतना करती रहती थी जानवरों के लिए, दूसरों के लिए, मुझे लगता है शायद वो यही चाहती हैं. And he went ahead and donated her organs. This is Sushant Kaushal, unfortunately a very young tragic death, like the donor in AIIMS Rishikesh. Young boy had a road traffic accident and his mother had already died. When I spoke to the father, what a phenomenal man. He said Sushant always liked to come first in everything, and sure enough, he was the first one to leave the world too. But mera beta ab saath zindagiyon mein jee raha hai. Young donor, both his kidneys, liver, both his corneas, heart, and in his case, his intestines, small intestines were used to transplant in another young boy who had not eaten solid food in 3 years. So That really is the beauty of organ donation. I really would like you to leave you with this thought. This father, Bhupendra was again a young boy who again had a road traffic accident. On my birthday, I remember I was having a party with my friends and I was called to the hospital, and I spoke to the father, one of the most exceptional human beings I've had the privilege of meeting. He, of course, they agreed to donate the organs. Later on, when I went to meet him in his house, you know what he said? मैं सोचता हूँ कि अगर मैं किसी और हॉस्पिटल गया होता और आपसे ना मिला होता तो मुझे तो ऑर्गन डोनेशन की बात ही नहीं होती, मेरा बेटा तो वैसे ही चला जाता, and I would not have had the opportunity to save the lives of so many others. Look at the greatness of this man. So it is important for us to talk about organ donation, not just to save lives, but because it is an inherent right of every individual in this country to be given that option. It is their prerogative whether they want to say yes or they want to say no, but we cannot be a hospital that does not give individuals and families the choice of organ donation. Thank you so much.
Thank you so much, Pallavi. I should say very motivating. Very, very motivating. I think definitely we all are watching you, and I think there are no words, I should say, and the words cannot explain the feelings what you have shown in 10 to 15 minutes. But I think the message is very clear. Message is very clear. Brain death is death. It is not brain death, it is death. And after death, how one person can bring lives to 8 or more persons. So
I just tell your young student, it makes life very, very worthwhile when you are involved in this process where you can use your skills to help families take decisions that save so many lives. I mean, how many people get that opportunity? And if we can take that opportunity, it is beautiful.
May I request Professor Meenu Singh ma'am to say a few words? She wants to share something.
Ma'am has written, I think her signal is low.
Okay.
I thought I'll work with some emojis. This was a wonderful talk and so motivating. And I do ask Pallavi that you should allow us to use this particular talk in future, for our training sessions.
Happy to share it, ma'am.
So thank you very much. It was very moving, actually.
Thank you, ma'am. Thank you for your kind words. I think with this, we move ahead now. I would like to invite my colleague, my faculty in the department. He's our associate professor in Department of Urology in Rishikesh, Dr. Vikas Kumar Pawar. And I think now the most important concept comes, we are moved away by everything. But I think our students and our healthcare workers really need to understand the things are not so simple, although they are simple. But if the understanding is proper and the team has an understanding, probably it is not a complicated process. So I think let us understand the process and the things, how it can be simple after understanding by Dr. Vikas. Dr. Vikas, please.
Thank you, sir, for the kind introduction. First of all, I wish to thank Professor Meenu Singh ma'am and Dr. Ankur sir for giving me this opportunity. I hope my slides are visible.
Yes, please go ahead.
So I will be speaking on diseased organ donation, a gift of life. So what is diseased organ donation? So it is a process of donating organs after death to save or improve the lives of others. With this process, organs such as heart, liver, kidneys, lungs, intestine, and pancreas can be donated. Before we dwell further, let us discuss what are the different kinds of death. So one is circulatory death, in which there is cessation of beating of heart, which leads to end organ ischemia. And brain death is a relatively newer concept in which there is irreversible form of brain injury, which leads to brainstem death. However, the organ perfusion is present because the heart keeps on beating and the patient is on ventilator. This brain death also leads to circulatory death in few hours to few days. And it is in this window period that the organs ideally should be procured from a brain dead donor. So now, depending on the type of death, the deceased donor can be classified either as a brain dead donor or donor after circulatory death. So donor after circulatory death are those patients who do not satisfy the brain death criteria. However, they remain to be continue on and life support like ventilatory support and organs from this donor can only be procured after withdrawal of the life support. So after withdrawal of the life support, there is a variable period of ischemia. So practically speaking, in Indian scenario, organ cannot be procured, are usually not procured from these donor, and these are usually tissue donation. However, few centers like PGI Chandigarh has started donation after cardiac death also. We must also understand that there is a difference between a brain death and comatose state. So brain death is an irreversible phenomena in which there is cessation of all form of brain activity. There is absence of brainstem reflexes. There is no spontaneous breathing, and it is a state of permanence. So why there is need for deceased organ donation? I think this has been covered by Mrs. Pallavi. However, I will just reiterate that globally 60 people receive an organ transplant in a day and 13 die for the want of organ. So there is acute organ shortage for these patients. If we look at the Indian data, the Indian Society of Organ Transplant data says that there are about 3.17 lakh patients who are waiting for organ transplant, and only 3.25% of these patients receive organ transplant, and rest of them likely die or they continue to suffer because of non availability of organs. Ministry of Health data also shows that there is a waiting list of over 3 lakh patients, and at least 20 people die each day for the want of organ. And since 2014, the organ donation has merely increased from nearly 7,000 to 16,000 in 2022. So if we look at the Indian data, nearly 80 to 90,000 patients die because of brainstem death due to road traffic accident. And this roughly corresponds to around 90 per million population. And we are only able to convert 0.6 per million population to organ donation. So there is a huge gap and a potential which can be bridged to solve this problem. So I will be discussing, now moving on to the donation process proper, I will be discussing the donation process under these heads. So the first and the most important step is the identification of a potential brain dead donor. So the registered medical practitioner working in intensive care unit must identify a potential brain dead donor and facilitate his or her brain death certification. Only patient who continues to be on life support and remains hemodynamically stable on life support and ventilatory support qualifies for organ donation. At the same time, the medical suitability for organ donation is assessed in these patients. Brain death declaration or certification involves a team of 4 doctors, of which at least 2 must be from a panel which has been recommended by state health authorities. None of the doctors should be a part of transplant team or related to recipient in any way. And brain death certification involves a prefix exhaustive list of tests which should be repeated twice with a minimum gap of 6 hours. And the donor family can be present during the performance of these tests. Once the brain death certification has been done, then the evaluation of donor eligibility is done. The medical, social, and behavioral history is looked upon. Physical assessment of organs is done by performing a battery of tests so that we can decide what all type of organ can be procured from this patient. Presence of any transmissible infection or a malignancy contraindicates organ donation. So tests are done to find whether these are present in these potential organ donor or not. So once the patient is deemed suitable as an organ donor, then the transplant coordinator of the hospital discusses the provision and opportunity of organ donation with the bereaved family. So the patient might have earlier registered himself or herself as an organ donor in the pre-mortem period. Even then, the consent of the family is needed before the organs can be procured from this patient. However, if the patient has already registered himself, this facilitates the conversation between the patient and the transplant coordinator. So the timely decision can be taken for organ donation. So once the consent has been taken, then the process of organ matching and allocation starts. So to understand this better, let us understand the hierarchical network existing in India. So NOTO is the National Organ and Tissue Transplant Organization, which is the apex body situated in New Delhi. Under NOTO, we have 5 regional organ transplant and organ and tissue transplant organization, which we call ROTO. And we have roto for north, east, west, south, and northeastern region. So each roto caters and covers 5 to 7 states. And some of the states have also formed state level organization with the name of SOTO. And under these SOTO, we have individual transplant and retrieval center. So each transplant center can also be by default retrieval center. So when each transplant center makes its own waiting list of transplant recipient, they share these lists to the state organ authority, state SOTO, if it is present. Otherwise, they share it with the ROTO. So at the state level waiting list is formed. At the regional level, the regional waiting list is formed. And when these regional waiting list from various regions are submitted to NOTO, a national organ waiting list is formed. So when a retrieval center identifies that we have a potential donor, then with the help of the nodal person at that particular center, they inform the SOTO if it is present in that state, otherwise directly to the ROTO that we have a potential organ donor. So out of the paired organs like kidney and lungs, one pair is given to the retrieval center and other pair goes to the common pool. For other organ, if the retrieval center has a registered permission to perform other transplant, then these goes to the retrieval center only. Otherwise, they go to the common pool. Now, once they are in the common pool, the organ are allocated according to the state level or regional level waiting list, according to the ABO compatibility and other matching. So the ROTO identifies the possible recipient, probable recipient, and identifies the center at which the recipient operation will take place. ROTO does the networking and coordination between the different hospitals so that the team which will be performing the recipient surgery reaches the retrieval center for procuring organs. So once the retrieval centers and patient have been decided, the retrieval team reaches the team reaches the retrieval center, and then organs are surgically removed by a midline incision in a meticulous way. So first of all, the heart and lung is removed, followed by liver, kidney, pancreas, and intestine. Subsequently, they are preserved at 4 degrees Celsius in a special solution, usually University of Wisconsin solution or STK solution. And after that, they are prepared for transportation to recipient hospitals. Organs are usually transported by ground or by air, depending on the logistics and the time constraint. And it is at this moment that the help of the local authorities for forming a green corridor is taken, because time is very critical to ensure organ viability in these conditions. So as we know, after procuring, the heart should be transplanted within 4 to 6 hours, the lung should be transplanted within 4 to 8 hours, intestine within 6 to 10 hours, liver within 12 to 15 hours, pancreas within 12 to 24 hours, and kidneys should be transplanted within 24 to 48 hours. Once the organs reaches the respective recipient centers, then the further process is very similar to the living transplant surgery. So the surgery is performed on the recipient, and similarly immediate post-surgical care and monitoring is done as for a live donor transplant. So in this way, by organ donation, each donor can save up to 8 lives and can improve the quality of at least 50 other patients by tissue donation. And it helps in forming a legacy of the donor family. So how can we help in this process? So we can register ourselves as an organ donor. We can discuss with our family and we can let them know that it is our own wish that we should become an organ donor, so that in the unfortunate event of brainstem death, they are not in confusion whether what my child wanted, what he wanted, so that they can take an informed decision and be a part of this legacy. A final thought before I wind up. So deceased organ donation is a powerful act of generosity that saves life. And by registering as a donor, you can leave behind a legacy of hope and healing. So be a hero, register as an organ donor today, and do spread awareness and encourage others also to become donors. Thank you.
Thank you so much, Dr. Vikas. I think you really made things simple, and simple for everyone, I should say, our students, and probably it makes the understanding regarding this process, sometimes it's really look complicated, but I think things are pretty clear now. I would like to say one thing actually to all our students here. See, we always talk about organ donation, we talk about pledge, right? The consent, which is in India, we are talking about pre-mortem consent, right? But as Dr. Vikas said, the pre-mortem consent is not enough to convert them into donors. So I think the most important thing is that whenever we have a pre-mortem consent in the form of anything, it is important that we share our thoughts, we share our feelings, we share our decision to our near and dear. They should understand, they should know what exactly we want, because unfortunately at that time, they are the person, those who will take a decision on our behalf. So I think in India, probably this is very important if we really want our wish to come true. And it is voluntary. Exactly, it is totally voluntary. There was a question in the chat box by Dr. Jitendra. He's our neurosurgeon. I think that I can discuss. Dr. Shroff, can you just take up? He was talking about Spain. He was talking about Spain. Why so much of it is, donations and availability of organs is because of the policy of consent there. Probably what they deal is presumed consent, if I'm not wrong, not the pre-mortem consent which we have. So you are one of the member in the policy makers also. We talk so much upon. So regarding the shortage of organ, is there anything going about the consent form in India? And is this a gray area where really our society need to work upon, or our policy makers need to work upon the type of consent?
Yes, thank you, Ankur. It's a very good question, very important question. The Spain's donation rate has always been high for a few reasons. One is that, it was not necessarily the presumed consent itself which increased the donation rate. Spain had presumed consent for 10 years, and it was not increasing. The donation rate was not increasing. Then came a gentleman called Rafael, who was, who looked at this whole program, and he found, in his research, he found that it is the intensive care where everything happens. And so he empowered the intensive care by putting certain processes in place, including having a transplant coordinator in the intensive care who could be either an intensivist or a nurse, and giving them training on how to, speak to relatives on organ donation. In Spain, despite having presumed consent, it's called soft presumed consent. There is hard presumed consent, there's a soft presumed consent. Spain follows a soft presumed consent. What it means is that despite having, presumed consent is unless otherwise you expressed your desire of not to donate on a national register, you're presumed to be an organ donor. So there's a soft presumed consent is about still asking the relatives whether they wish to donate the organs to their loved ones. So presumed consent is just an instrument to take a conversation forward on organ donation. In India, we have what is called mandated choice. In the intensive care, if you have brain death, you are, the doctor, it's a moral obligation of the doctors to ask for organs. So India introduced in 2011 a soft way again of asking consent, wanting to take away that, moral, they wanted doctors to ask. And that's why they introduced this transplant coordinator as well in the, as another person in the ICU to help doctors for taking consent of the relatives. So presumed consent is good, but presumed consent is not necessarily the only way by which you'll improve the organ donation rate. You will have to have processes. You will have to have systems in your intensive care. You will have to give an opportunity to a coordinator to speak to the relatives, because if you don't certify brain death, there's no opportunity to discuss organ donation. So in India, currently, we don't have, even if there's brain death, it's not certified. It's not identified. So if you don't have these two, there's no question of discussing organ donation. I hope I have given you
I think things are pretty clear and you have elaborated it very nicely. There is a question in the chat box. If a patient, is a person is a mentally disabled children, so do parents can make decisions for organ donation on their behalf, mentally disabled children?
I'll take this again because this is a little complicated. In disease donation, yes. But in living donation, that's a complication. You can't. Because, again, there have been instances where, this has gone to the court to take special permission, and the court also has said no. And there is a Disability Act in India, Mental Health and Disability Act, and that also has certain clauses. So yeah, in disease donation, yes.
Amrita asks very incisive questions. So I said the question around HIV also. So basically, the Transplantation of Human Organs Act gives the decision to, take the decision for organ donation to the immediate family, to the people who are in charge of the body. So yes, like Dr. Shroff said, in deceased donation, yes, but not in living donation.
Thank you so much. I think we are dot on time. The time is also important. I think wonderful sessions. Can I have a few words, closing remarks from Professor Meenu Singh? Ma'am, please.
Thank you so much for such a, motivating and stimulating webinar. I think this education which has been done today will go a long way in establishing deceased organ program in AIIMS Rishikesh. And I request all the speakers actually to allow us to, put these talks on our AIIMS Rishikesh Digital Academy, which is, which ultimately would go on to YouTube. So I think, Ankur, if we can take their permission because we've recorded the webinar, it'll be very educative. And thank you very much. Thank you so much. It was really good.
Thank you, ma'am.
Thank you so much. Thank you so much, everyone, once again, on behalf of Uttarakhand Telemedicine Society. And thank you so much for coming on virtual platform. And, this was something, not a webinar, I should say. It was, it was something we were attached with by heart. When you guys were talking, something feelings we can see in your eyes. It was not just a talk. I think, as ma'am said, very motivating, and we'll be happy to have these talks on our academy platform with your consent. I will channelize and coordinate with you guys. Thank you so much. Thank you for all our students, all our speakers, and all stakeholders. I should say they are still here, and we have all the team. And it's a very good sign, I should say, for the institute. Thank you so much.
Thank you, Uncle.
Thank you.
Good night.
Thank you, ma'am.